Well, the number of dead from the coronavirus outbreak now stands at 813, all but 2 of the victims dying on the Chinese mainland. The virus has now killed more people than SARS nearly 2 decades ago. It has also infected more than 37,000 people worldwide in over 24 countries. Well, for a closer look, we are now reaching out to Dr. Richard Chavous. He is Ontario's former Chief Medical Officer, also the former Chief of Staff at York Central Hospital at the time of the SARS outbreak. He joins us right now in Toronto. So, Dr. Chavous, thank you for joining us today.
Pleasure.
I want to begin here by asking you what you make of these reports, that the number of dead now surpasses the number of people who died during the SARS epidemic. Is that reason to worry?
Well, I think what it says is that this is a much larger outbreak than the SARS outbreak was. The number of dead is already higher. It will continue to grow, of course, because the outbreak is far from over. But I think also there's a lot of what I find actually quite encouraging news coming out of the outbreak, particularly coming out of China. And with all the caveats about the issues of reliability of the data and biases built into the data, what I find most striking about this outbreak is actually how localized it has remained, how much the 95% of the cases or somewhere in that range have all been in this one province in China. If this were, in fact, a highly infectious disease comparable, let's say, to influenza, we're now 2.5 months at least into the outbreak, it would be far more widespread. It would be across the Chinese continent. It would be expanding elsewhere. We would be looking at this point in time at hundreds of millions of cases and tens of thousands of deaths. And we're not seeing anything remotely like that, which is good news.
So good news that it doesn't seem to be as infectious as SARS. But, you know, when you look at the number of patients who've actually fully recovered, to my understanding, that still remains low. Does that say anything to you?
Well, let's be clear. It's more infectious than SARS. SARS was not at all a highly infectious disease. This is a more infectious disease. But on the other hand, it appears to have a substantially lower case fatality rate. It seems to be substantially less virulent than SARS was. So we have to follow the data very, very, very carefully. But I think trying to put all of this in context, trying to see the big picture, it's not spreading rapidly. There's some indication that the case rate in Hubei province, which is where it's centered, is actually peaking, which is very good news. And it doesn't seem to be taking substantial root elsewhere. We have a huge advantage over our efforts with SARS 15 years ago because we now have rapid diagnostic testing. We really didn't have any diagnostic testing for SARS. It was all clinical work. Now we have rapid diagnostic testing, which should allow us to identify cases. And when cases appear elsewhere, as they have, they've appeared in more than 20 countries, including Canada. But because we can identify them, because we can then isolate the cases and put a cordon of observation around the cases, we should be able to control this. So I am cautiously optimistic about what's going on.
Okay, cautiously optimistic. Of course, we're going to keep following it. And certainly one thread that we're following right now has to do with efforts to prevent the infection spreading on board a cruise ship, in particular the ship off Yokohama, Japan, the Diamond Princess. More than 3,000 people are on board, among them some 200 Canadians, and they're now quarantined. Is quarantining people on a ship the best way to prevent the spread of infection?
Well, this is like something out of the Middle Ages. The whole concept of quarantine goes back to the Middle Ages and misguided efforts to control the plague. And a ship would pull into a harbor with sailors on board with the plague, and the authorities would keep them on the ship till usually all of them died. In the meantime, the rats with the fleas were leaving the ship and going off into the city and spreading the infection. What we're doing to these unfortunate people on the cruise ship makes absolutely no sense. Yes, there have been some cases, but locking them all up together in exactly the kind of environment where a respiratory virus is most likely to spread makes no sense, and there's no telling how long they'll keep them in quarantine. They should check the people for infection. They should let them off the boat. Those who aren't infected, they should let them off the boat, and they should put them under some form of observation for the next 10 days to 2 weeks. That would make far more sense.
So what are you going to be watching out for next year?
Well, I'm going to watch the data very carefully. Again, I think that the data is the key to understanding what's going on. So far, as I say, it's actually been quite encouraging. I'm going to pay particular attention to what goes on in Hubei province. That's where the outbreak got established, where obviously it was quite widespread before any control measures were taken. And we'll see what's going on with cases there. The deaths are important. Deaths are important because they're less vulnerable to the kind of reporting biases that make the other data difficult to follow. But the deaths also tell us what really happened in terms of the outbreak 10 days to 2 weeks ago. But the fact that the rate of increase of deaths in Hubei province appears to be peaking is very positive news. It's too early to declare victory over this thing, but I think we need to watch those numbers very carefully.
Dr. Chavous, thank you for this.
My pleasure.
And that's Richard Chavous, Ontario's former Chief Medical Officer.